I'm Quentin Glies, and this is my final presentation project, and it's on Zika virus. Overview. Appreciating the profound implications on the Zika virus revolves around its ability to profoundly impact public health by posing a vital threat to expecting mothers and their unborn babies. The gravity of the virus emphasizes the urgent need for ongoing research, extensive public health initiatives, and worldwide cooperation to mitigate its repercussions through the collective endeavors safeguarding the most vulnerable populations and containing outbreaks of the Zika virus becomes achievable. Symptoms and severity. Zika virus symptoms can vary significantly, with some individuals never showing any symptoms, but when symptoms do appear, they usually are mild and may resemble those of other diseases transmitted by mosquitoes. Typical symptoms include fever, rash, joint pain, muscle pain, and headaches. While many perceive the virus infection as a mild sickness, its severity can vary to different factors. It's important to highlight that despite its mild nature, in some cases the infection will have serious consequences, primarily on pregnant women and their children. In a lot of cases, the Zika virus infection is classified as a mild illness, but the severity of the infection can vary based on several components. It's crucial to recognize that despite its mild presentation, the viral infection can lead to critical outcomes, primarily affecting pregnant women and their unborn children. What is Zika virus and its transmission methods? The most important source of transmission of Zika virus is through the bite of a mosquito, especially the Aedes species discovered in 1947 in the Zika forest of Uganda. Public health concerns about this disease, which is initially thought to be a minor illness, have recently increased its high concern. This is mainly true to the fact that this is related to childbirth and the neurological concerns seen with the pregnant women and their babies. The Zika virus can spread throughout various means, such as mosquito bites, vertical transmission from mother to child during pregnancy or childbirth, sexual contact, blood transfusions, and laboratory exposure seen through blood tests. Spread and prevention. The Zika virus can be transmitted through various methods of transmission, including mosquito bites, vertical transmission from a pregnant woman to an unborn child during pregnancy, leading to significant developmental and birth defects. It can also be transmitted through sexual contact from someone who is infected, which infects their partner. This is also true for blood transfusion and organ transplantation. Preventing infection involves several measures for prevention. It's essential to minimize contact with mosquitoes by utilizing repellent, eliminating standing water, wearing protective clothing, and minimizing outdoors activities during mosquito season. For sexual protection, use condoms and practice safe sex are crucial. During pregnancy precautions, avoid travel to affected areas, attending regular parental care appointments, and educating oneself about the virus. In lab settings, use proper decontamination practices, report promptly, appreciate appropriate responses are essential in handling the virus, especially in laboratory settings in case of needle stick injuries. Diagnostic methods. Diagnostic methods for Zika virus typically involve laboratory tests that aim to detect the presence of its virus and antibodies in the individual's blood, urine, or other bodily fluids. The polymerase chain reaction (PCR) test identifies the genetic material of the Zika virus bodily fluids or blood and urine. It also is used in the early stages of infection when the virus is actively present. The serological test detects any antibiotics produced in the body's immune system in response to Zika virus infection. An enzyme-linked immunosorbent assay and plaque reduction neutralization tests are all examples of serological tests used to detect Zika antibiotics. The nucleic acid tests, these detect the viral genetic material in samples confirming an active Zika virus infection. Virus isolation techniques are culturing the Zika virus from patient samples, such as blood and urine, in a laboratory setting. These diagnostic methods play a crucial role in identifying Zika virus infections. Global impact. The Zika virus outbreak has significantly influenced global history, societal factors, and socioeconomic aspects. Public health crisis. The Zika virus outbreak, particularly in South America, posed as a major public health crisis. The rapid spread of the virus along the link to severe birth defects caused a worldwide global concern. Healthcare system strain. The outbreak made it challenging for healthcare systems in affected areas. They had increased surveillance tests, care for pregnant women, and help for babies being born with Zika effects, stretching healthcare resources. Tourism and economy. Areas affected by Zika outbreaks experienced a decline in tourism and economic activities. Concerns about the virus led to travel advisories and cancellations of trips, affected destinations, impacting tourism revenue and local economies. Global health response. The Zika virus resulted in health groups, governments, and research centers worldwide working together. They joined forces to help stop the virus from spreading, share information, and create plans to prevent it and handle it. Long term implications. The Zika virus effect on communities, particularly on babies being born with birth defects, can have everlasting effects. Families and healthcare systems might have ongoing difficulties in looking in after these children, including their medical needs and fitting into society. Case study and outbreak examples. Brazil. During the period of 2015 to 2016, Brazil faced a predominantly highlighted outbreak of Zika virus. This escalation attracted significant attention owing to a remarkable surge in birth abnormalities, specifically instances of children being born with microcephaly. This condition was subsequently correlated with mothers contracting the virus during their pregnancies. Brazil's outbreak serves as a catalyst for increased awareness as the implication of health initiatives throughout the Americas. Puerto Rico. The Zika virus in the Virgin Islands and Puerto Rico between 2015 and 2016 was very serious for people's health. In both places, there were many cases of the virus that authorities gave out health warnings and took strong actions to stop it from spreading. This situation showed how important it is for health groups to be ready and work together, along with the community getting involved with new diseases are on the rise. Conclusion. In summary, the Zika virus outbreak highlighted the importance of global health collaboration and the need for swift responses to new diseases. Lessons from the experience are vital for future readiness research and health strategies to help tackle potential health risks worldwide. The Zika virus outbreak poses a major global health challenge, prompting extensive research and collaborative efforts to comprehend, reduce, and manage its impact. As knowledge about the virus grew, it became clear that ongoing research is crucial, and not just for immediate health needs, but also for advancing scientific knowledge, enhancing preparedness, and protecting global health from new infectious diseases.